video. Okay, let's get into it. We're going to be covering the basic overview in this part 1, including pathophysiology and memory tricks. And then we're going to break down some practice questions toward the end of this video, including the really tricky fully compensated versus partially compensated ABGs. So be sure to stick around. So what are acid-base imbalances? Well, it's just the balance of acid and base of the body, kind of like a tug-of-war. The body loves to keep these in balance. Measured in blood via the pH. So normal pH is 7.35 to 7.45. Too low, under 7.35, we become acid. Basically, the body goes into acidosis. And too high, over 7.45, we become more base. The body goes into alkalosis. Now, that sounds pretty simple, right? Well, here's where it gets confusing. The key players that keep us in balance is HCO3, known as bicarb. This is our base. That helps to put the body in this alkalosis. So the memory trick, think of the double B's. Base equals bicarb. And CO2, our carbon dioxide, is our acid, pushing the body into an acidotic state. So too much CO2, we get a body that is in acidosis. So the memory trick we use, just think carbon dioxide is carbon diacid, since too much carbon dioxide pushes us into acidosis. Lastly, hydrogen ions are a form of acid, found in the stomach acids as well as urine. So the memory trick, just think hydrogen ions is high acid. Too much hydrogen ions equals an acidotic state. Now, simply organize this in your mind. What makes the body acidotic? Well, hydrogen ions get high acid, and carbon dioxide, just think carbon diacid. And for base, which makes us alkalotic, just think bicarb base. Now, the main organs that control these are the lungs and the kidneys. So the lungs control carbon dioxide, that's CO2. We breathe in oxygen and breathe out that CO2. Normal gas exchange, right? So just like you heard, the main way to get CO2 out of the body is by exhaling. So the less you breathe out, well, the less CO2 comes out. And so more CO2 is retained in the body, which makes the body more acidic. So remember, more carbon dioxide means more carbon diacid, a very acidotic body. So naturally, decrease in respiratory rate, we have more acid from more CO2. Now we see this in patients who are intoxicated or overdose, or even a head injury. We have low respiratory rate, so CO2 is higher in the body. And with increased respiratory rate, we have less acid, that less CO2. Like with hyperventilation from an anxiety attack. We breathe out all that CO2, so the body becomes less acidic and more alkalotic, that base. Now on the other side of things, the kidneys control two key players here. Hydrogen ions and bicarb, HCO3. The kidneys regulate this acid-base imbalance by excreting more acid into the urine and retaining more base, bicarb. Kind of like a teeter-totter or a seesaw here. So in the same big video, thank you guys so much for watching. Please be sure to download your cheat sheet study guides as well as take the quiz on the membership site. And please be sure to share with your classmates and instructors. Thanks so much for watching.